We can start, and here we go.
Hello, everyone, and welcome. Welcome to our Stakeholder Engagement Workshop agenda. I will start by saying, please mute yourself if you have not already done so, if you're not speaking. So my name is Susie Johnson. It's so good to see those of you who I've met, and I'm really looking forward to meeting the rest of you. So I just want to welcome you to this training session. I'm the Public Health Project Manager for the Mexico Alliance of Health Councils, and leading this training will be the Reverend Dr. Ann Egan with New Ventures Community Building, and myself and Susan Wilger, who is consultant for the Alliance and Center for Health Innovation, will also be having part in this, just so that we can sort of emphasize how important stakeholder engagement and partnerships are to the work that you're going to be doing. So I also want to mention that I'm part of the core team that creates these training sessions. And I want to take a minute to just thank everyone who has just helped us so far up to this point. So many people to list, but all of our consultants, partners, DOH folks have been really, really essential. And I just wanted to give like a little shout out to Madeline, because I don't know about anyone else on our staff, but she keeps me straight and she helps us to get all this together with all the technical part that I wouldn't even know where to start. So thank you, Madeline. Give us some wave, Madeline. Does anybody know who she is? Oh, Madeline, love her. Okay, so please put your name. Yeah, I know you know the drill, but I'm going to say it anyway. Put your name and the name of your health council in the chat. If you're comfortable, please turn your video on. I mean, we're all in this together. So and also I would love to kind of know what you guys look like, because I've talked to some of you and I can't even put a face to a name yet. So if you feel comfortable, please do so. Before I go over the interview, the overview of our session today, I just wanted to make a point to mention that I just want to give like a little announcement, because I'm really proud of everyone, regardless of what stage you're at in this process. I just want to let you know that everyone has been doing very well. So we have 78% of all health councils have signed on, and those who have not are working very hard to do so. So I just wanted to celebrate that. I also wanted to mention that well over half of the health councils that are participating in the CDC project have identified a health equity committee and are also very involved in doing vaccine related events. So, woo! And also, so yeah, just another reminder for those of you who are just now joining, please remember to mute yourself if you're not speaking. If you feel comfortable, turn your video on, and don't forget to put your name and the name of your health council in the chat. We keep it for attendance purposes. All right, so just a brief overview before I turn it over to Anne. So the first half of our training will be, Anne will take the lead, and she will be giving an overview of what stakeholder engagement is. And then Susan and I will kind of talk about ways that it will help you in your work and what we've been hearing from you all. We'll take a short break, and then we will break out into small groups. And I personally am going to say, please stay on when we're doing the small groups. That's like, I mean, it's all important, right? But that's just really important so that we can learn from each other. And also, when it comes time to selecting someone who will take the notes and report out to the larger group, please volunteer if you haven't done so, because we want to hear from everyone, and we want everyone to have a chance to be able to take a more participatory part in these sessions. So yes, that's kind of the last part of the training, and then we will be wrapping it up and answering any questions and just kind of summarize everything that we've learned. So with that, right on time, I will turn it over to Reverend Dr. Ann Egan.
Thank you so much, Susie. I'm really thrilled to be with you all this afternoon, and thank you for coming. I know that our plates are not only full, but I think most of us are ready for vacation. It's been quite a year, hasn't it? If it's been quite a year, raise your hand or put your hand up. And for some reason, I'm the one now that's being asked to admit people, so that's a bit of a problem for me.
Don't worry about
Yes,
it.
I see lots of hands. That's great. All right. So, real quickly, what we'll cover today, Susie has covered what we'll cover today, so that's terrific. And what we want to do is make sure that at the end of this workshop, you've had a chance to really look at the definitions of stakeholder engagement, examples, some tools and resources, and then also really have some discussions as you're in your small group, so that the health councils will be talking about where you see your strengths in stakeholder engagement, where you've got challenges, and what some of your priorities are. And what we're going to do is we're taking notes on Jamboard. And so what we want to be able to do over the next couple of months is to be able to share within the network what you really see as your strengths, so that what you can do is to really share with one another. And what I'm discovering, Madeline, is I can't let people in, and I'm doing share screen. So are you able to let people in, Madeline?
Yeah, don't worry
I'm
about letting
letting
people
in.
in. We've got a couple people that are managing that, so you don't have to worry about it.
Thank you. Yes, I am technologically challenged also. So anyway, what we're going to be doing is we want to be able to build, you know, a matrix or some sort of a map where we share with one another the kind of skills that everybody brings to the table. So I'm not able to advance this now. So let me try to start sharing again. Okay, there we go. So stakeholder engagement, the first thing I wanted to talk about is we have lots of lingo, and one of the things that we're working on is sharing our definitions so that we actually come from a similar place. The interesting thing about stakeholder engagement is it's a broad, overarching term. There's a lot under that umbrella. So, you know, engaging in outreach, involving people in different events and activities, bringing a diverse mix of people together, reaching out and involving diverse representations. The outreach work around equity is really part of stakeholder engagement. When we're looking at engaging, community organizing is a great way to really engage one another. And involving people in groups that are working on health council goals and priorities, that's also stakeholder engagement. And one of the things we found, I think, is that the relationships that we have really make stakeholder engagement real. And when we have relationships with people in the community and we talk with them about why we need them involved, that really makes for a much richer conversation than, you know, you're making a cold call. And ultimately, all of this, when we're looking at becoming more deeply engaged, our stakeholder engagement then moves into partnerships. And so if we look at the CVPR training that we had earlier, when Victoria and Nina were talking about partnerships, partnerships represents one of the richest, deepest forms of stakeholder engagement, because we're working together around a common issue or goal over time. So the partnership piece is a really deep form of stakeholder engagement. So we use a lot of different words. And we engage one another around our plans and priorities. I think probably a number of us have had times where somebody would say, well, would you come to this meeting? And what do we usually ask, either internally without saying it out loud, or what do we ask out loud? Hey, would you come to this meeting? What's it about? Why do you need me? And so we need to have a reason to connect, and that is the need or the issue, and a priority and a task. And it's also knowing that you need me or my organization, and then the potential to make a difference. Because so many of us, all of us, I think, especially during COVID, we are so swamped. We want to look at things and go, okay, what's most important. So we need to have a reason to connect, a potential to make a difference, and then the relationships. And all of that really helps sort of fuel our work together. And we have a number of health councils that have been involved with us in a Robert Wood Johnson funded initiative. There were 6, and one of the 6 is a partnership, Lincoln Otero. But as we worked on stakeholder engagement, we developed together a stakeholder engagement framework. And it's one, if you find it useful, great. I think we have so many different ways to visually, and graphically depict stakeholder engagement. But basically, we all want a healthier future for ourselves and our families and our communities. We want to have healthy communities. And in order to get there, and those are the arrows, we really need to come from a ground where we're really focused on racial, ethnic, cultural, social, economic, and health equity. Because when we have that as a ground, then our strategies are a lot healthier. And there's so many different groups that we can really connect. And if we're looking at an issue, so perhaps if it's around behavioral health, then healthcare providers, behavioral health providers, local government advocates might be involved. If we're looking at trying to address youth suicide, we're focusing on behavioral health providers and childcare providers in our schools. So oftentimes when we're looking at an issue, that's why what the issue is and the difference people can make, we really look at all of these potential networks to see who might we connect with and why do we need to really reach out more. Oftentimes there are more groups in the community, even in smallest communities. There are more people in groups doing things than might be sitting around the table at the health council. So there's always an opportunity to expand our own health council communities or families. And there's such power in connecting. One of the things that some groups do, which is a great stakeholder engagement strategy, is have a conversation sometime with either your leadership team, and then maybe doing the leadership team and then building it with the whole council. And you might have just a huge butcher block paper, and you take a look at all of these different people that are involved in the health council, and who do you know, and what are your networks? Because oftentimes if we look at stakeholder engagement and we say to ourselves, well, who has a great relationship with the tribal governor? Who has a great relationship with the community schools providers? And then those people may make the introductions and might provide an invitation to a discussion group or an event or a health council meeting, because those relationships are so important. And doing that kind of mapping is also fun, because you realize, oh my gosh, together we have incredible relationships and networks that we can leverage and get more people involved in the health council. So let's see here. So I sent you all a checklist, and a lot of this material came to you in PowerPoint and in a checklist. I added 1 or 2 extra PowerPoint slides. But I think together, we're going to use this as a jumping off point. And by the time we gather a lot of information from different health councils, we'll have a huge, robust mix of stakeholder engagement strategies that you're using that relate to many different settings. So there's the general outreach. You're going to send invitations to your health council meetings, to different events. Vaccine equity. I mean, one of the wonderful things about our partnership with DOH is they're coming out soon. And Roberto, if you're on here, we're going to be talking about some of the new resources you're bringing, because we've got new mobile vans that are coming out for vaccines to reach underserved areas. And then also we've got a FEMA bus or FEMA buses that are coming out, I think 1 per region. And so part of what we're looking at is, you can use general outreach to, and that's the easiest that reaches the most. So that if you're looking at communication with a funnel diagram, you do all of your outreach, sending invitations to health council meetings, information about the events. You do that with general outreach. And what's exciting about our opportunities today is that we have both in person and Zoom. General outreach can be
I'm
done
trying to learn my phone.
through website.
On top of that.
Please mute if you would. Thank you. Please mute. So we do general outreach through large groups, email, websites, newsletters, blasts, and a lot of our general outreach is also done through digital outreach. And some of the digital opportunities are so exciting. And so we've got the social media, we've got videos, podcasts, storytelling, and then there's sector-specific outreach. So as you work to further develop goals, oftentimes you may be sending emails to working groups that are working on goals or priorities that are focused on particular areas of need, planning activities. One of the things that health councils are doing as part of the House Bill 137 is that health councils are called health planning councils, and health councils are really responsible for community health planning. So there's a lot of work there, and also in partnership with DOH, because DOH works on its SHIP, the planning piece that's on the DOH side. Personal contacts and relationship building are so important, and that can happen in multiple ways. You know, our meeting, the health council meetings are really the core and where a lot of great discussion happens. And then the health council leadership, both the coordinator as well as other health council leaders, really can then move that personal contact and relationship building to a deeper level. And I want to ask you, health council coordinators, how many of you got a whole lot on your plate? And when you're looking at your schedule, you're going, I asked a similar question earlier, but go ahead and put your hands up or use an emoticon. One of the things that's so powerful about, thank you, Edith. Yes, I know you do so much wonderful work. And what's so powerful about shared leadership is if you have a number of volunteers that are sharing different pieces of the work and they're taking the lead in certain areas, your work becomes so much easier. And one of the reasons why in this CDC funded work, we focused early on the hiring is that we knew that health councils we've got so much that you're doing. So you're bringing on some paid staff or contractors, and also hopefully you can expand the leadership as well. And then if we're looking at equity-based community organizing, involving more people, using different strategies to map your networks, looking at phone trees, some of the community organizing that's done around public policy is really exciting because you get email or phone trees and you engage a lot of people. I can remember years ago with Los Alamos was putting in some requests for the community, for the county commission, and the health council packed the county commission chambers when there was a presentation, and the county commissioners went, "Ooh, ah." And the same thing has happened with a lot of you. Look, Rio Arriba brought 60 people in to present, to support a presentation to the Legislative Finance Committee. And those kinds of things are really powerful, and it's a kind of an equity-based community organizing. So as we look at all these strategies, the last thing I wanted to mention before I introduce the health councils is at a foundational level, you know, if you're small or you're just getting started or restarting, your focus will be on the foundational activities, general outreach through email, blast, and newsletter, regular meetings. The regular meetings are just core, and then notifying people and providing updates. And then as you grow, then there are varied mixed methods. You get a more diverse representative leadership, you share the work, you engage community members and task forces or committees, and you start having some topic related communication. You increase in terms of the equity focus and active outreach, and the relationships build as you then become highly engaged and interactive, and you are active and engaged, and you share, and you really are involved in community planning that's data driven, and you have multiple stakeholders and a range of activities. And so this is sort of a developmental series of building blocks, and we all start here and then build as you grow. So as we look at the next step, at this point, I would love to introduce health councils who are going to share some of what they've been doing with stakeholder engagement. And it really puts everything into a practical context. So to kick us off, we're going to have Troy Campbell from San Ildefonso, and each of the health councils is going to spend 2 to 3 minutes sharing their stories. Troy.
Good afternoon. How are you? Can you hear me?
Yes.
Yeah.
Okay. I didn't really know what I was supposed to present today, except for some of the conversations we had on this topic. But we, traditionally the Pueblo has used the tribal bulletin as its method, paper copied, goes out once a month to engage the community on the events or activities, whether it's vaccine related or other activities in the community. And we realized that that's with COVID and the way things are going, we needed to expand the way that we did things. And so in addition to our CHR and our diabetes program staff going out to the homes to do home visits and delivering information that way, we've also kind of gone to some hybrid formats. One of the ways that we do our stakeholder engagement is we do a hybrid version of the demonstrations, where we have some folks that are appearing via virtual means, and some are allowed to come in person. Of course, limited options or limited capacity because of the COVID restrictions. We also have a community blast that we use. It's a digital web. How do I describe it? A web-based blast option that sends out a voice message to whatever we want to send out to the community, to their phones, home phone or cell phones, plus text messages and emails at the same time, to provide information, especially topics surrounding COVID vaccinations and testing events and exposures that happen within the community. Because we do a quadruple duty of being a health and human services and health council, but we also are the COVID response team. So we handle all of that as well. So we have to utilize all these different means to get out to people. We also use social media. We pretty much have every single form of social media that you can imagine. YouTube, IG, Instagram, Facebook, Twitter. We just recently signed up for TikTok and don't know how to use it yet, but I'll figure it out. Everybody else is using it, so why not? We also have a new website, or the tribe actually created a new website, and there's options on there as well to provide either video or text versions of whatever we're trying to present the community to engage them. But the thing that's in its infancy that we are really, really proud of, we haven't really started, we're hoping to start it by January 1st, is that the Health and Human Services Department is going to be hosting its own podcast. And so podcast is going to be basically a more I guess, semi-scripted version of community engagement, where we, as a team, we take turns providing information to the community. We also make it live. So the community, as they're watching these events and these activities, they can actually comment in real time, asking questions and communicating with us about whatever we're presenting, whether it's anything health and human services related or COVID related,
That's awesome, Troy. We want to capture everything you've just shared. So I had sent you an email a couple of days ago, and we'll follow up after this because I want to make sure we capture the rich mix of the types of social media that you just shared. We do need to move on to our next presenter, and that is Diana Good from Valencia Community Wellness Council. And she has one slide, and let's see if we've got this correct here. And I apologize. I'm having some trouble for this. So as we pull in, Diana, why don't you get started and I'm going to get your slide up here.
Good afternoon, everybody. My name is Diana Good, Health Promotion Specialist for Valencia County, and I'm here for the Community Wellness Council to let you guys know kind of how we do community engagement. And most importantly, whether or not the slide gets pulled up, I at least try to make it really fun and active. So that doesn't mean just for the kids. Even adults need to usually touch something, move around, like move themselves from one part of the building to another, do something with the thing that we gave them. And it's about attending to folks' learning styles. So if there's auditory stuff that's happening that they can listen to, that they can see, that they can touch, they can feel, better yet, if they can taste it, but it's not always possible. But it's really important to, first of all, remember that there is no higher and lower stakeholder, meaning a mom with 3 kids is just as valuable of a voice as a commissioner or a council person. So we do all the versions of stakeholder engagement, meaning we talk to stakeholders. It's just the next slide, I think, if you just push the advance button. You can just click on number 10. There you go. Cool. Yay. So we do policy maker presentations. We go to the council chambers and we do our PowerPoint, but that's important for them to see the data and they get that in their packet ahead of time. But we also give them sticky dots and we ask them to vote on our mega poster of leading health indicators from the Healthy People 2020 or 2030 process so that they have a voice in what priorities they think we should work on. But their voice is not more important than the folks that we engage at our crunches. We have something called Collaborative Rundown on Community Health, and they're about quarterly. And now they're issue focused. So we get people's input at those events as well. Same poster, same sticky dots. We also go to any health event and do general public one-on-one interactions and really get them to look at our data and think about what's important to them, not just from the data point of view, but how has it impacted their life? Like, do they know somebody who has suffered from COVID or diabetes or any other health condition? So the other thing we really pay attention to, I've got 5 seconds left, is to make sure that if you're asking somebody to do something, that you give them something in return. So if you're asking parents to take a survey, you provide something for the kids to do, even if that's painting a piece of cardboard. I actually ran out of birdhouses at one of my events there at the Halloween gathering, and the kids were happy to paint junk out of my trunk of my car. So I just brought things and we had leftover paints and they had a great time. So as long as the kids are entertained, and sometimes the kids can actually participate in our health priority selection as well. So there are no higher and lower people. All voices are important, and we really try to make it fun. And we always have a spinner wheel, win a prize, do a game, get some bubbles, whatever it takes to get them to the table in the first place. And that is my time.
Awesome. Thank you so much. Diana, we're going to send this out to the group when we share the summary. And the next person to share is Chris Hudson from McKinley County Health Alliance. Chris.
Hi, everyone. Can you hear me fine?
Yeah, great.
Yeah. Okay. Hi, everyone. I'm Christopher Hudson, coordinator for the McKinley Community Health Alliance here in McKinley County. And I guess I wanted to talk a little bit about how we formed and how we've grown from there. We started about 25 years ago. We were contemplating that earlier during our core group meeting, but we've been around for 25 years now. And we started around, how would you say? Oh, can I share the screen if you don't mind? Just gonna share our website and stuff. We started in around 1998 around Medicaid managed care and how we were gonna roll that out in the community. We were asked to kind of look at that and a group of individuals, founding members came together and just started having those conversations over, some candy or food and coffee, probably. I think I remember coffee in a lot of the pictures, and it just started from there. From there, it grew on to join with the Maternal and Childhood Health Council within the county. The Health Alliance and the McKinley Health Council merged, and the stakeholders grew a little bit more, from that smaller group to more initiatives and pieces in the community. Before then, they had already been involved with the McKinley Early Childhood Coalition. And from there, they had pulled in more stakeholders to tackle more McKinley Health determinants, including, child health. And I know the kids count stuff was very much involved in that. SNAPs, a lot of the county things and initiatives. And then from there, we just grew over the years. We started to get more involved with community organizations, grassroots organizations from like Strong Families, and also from Somos Un Pueblo, a lot of the Navajo Nation even before then. And I think our stakeholders have always been varied and very different depending on the needs that are going on in the community. We really have been able to tap into a lot of people that'll come to us maybe just for, a year's worth of work or a year's worth of doing this and then moving on, or coming back and continuously like, oh, we have this going on now and now we're going to do this. And we try to work with all those stakeholders and recognize what they're all good at and bring it into the community as well too. It is difficult though, trying to figure out who's all where. I think in 1 year, we have a Prezi here that I did 1 year, just kind of around, I can't see the bottom. So this is like all of our alliance, and then we had our people that we were looking out for, but this was in 2018. So a lot of half of these groups, including, Legal Aid and the New Mexico Public Health Institute and Our Together for Brothers, have been very much more a part of our group as well too, a part of the alliance and carrying on some stuff and working with us and forming partnerships around the initiatives and the stuff we're working on. And now we have a roster of about 150 individuals that we can kind of work with and get at things. So recently, we've done a lot of work within RMCH and things going on there, and they have tapped us into a lot of doctors in the area. So they have actually become stakeholders in a lot of our stuff. And then finally, this past year, we really stepped up our game on social media. Our Health Alliance's Facebook page is going. I still need to start a Twitter and all the rest of this stuff, but that's a lot of work. It does encumber a lot of things. I think we learned from one of our other partners, Mexico Social Justice, it'd be better off just to hire an own individual to do your social media management, which they did and which we're looking into as well too. So we learn a lot of new things from all our stakeholders, and we like to share that all together. It's a little hodgepodge sometimes, and I like to say that a lot of it is very organic work that comes from the community because we let it grow from there and let it happen kind of serendipitously, and let those relationships really build upon each other. Sometimes it's always the best way, but also accidentally having two friends run into each other is really good. As coordinator, I try to make that happen, but I'm always happier when it happens better on their own terms. So thank you.
Oh, thank you so much, Chris. And love what you said about things happening organically. That's certainly a really wonderful thing to focus on and keep track of. The last person who's going to share is Lauren Reichelt, and she had a meeting in Santa Fe County, so she was going to connect by phone. Lauren, are you with us?
I don't see her on the list of participants, Anne.
Okay, she gave me a little bit of information to share in case she couldn't make it on. And one of the things that Lauren like Chris, the Health Council's been around for a long time. And it started actually literally in a broom closet. And she started the Rio Arriba Health and Human Services Department, which is the umbrella for the Health Council. And they just developed piece by piece. And so their stakeholder engagement involved developing a number of pieces and then continuing to grow. And there were 2 or 3 things that she shared over the years that have really made a difference in stakeholder engagement. One is just finding different ways to build those relationships. And that's been captured by Troy and Diana and Chris. And to also bring people together around topics and try to find funding so that if you have a topic for tobacco cessation, or you're bringing in promotoras to do outreach and navigation or community organizing, or you're working to pull together aging services, then those agencies that are working in that topic area, in your priority area, can work together. And she was able to bring people together and get funding, and that makes a huge difference. The other thing that she's mentioned that's been really important in stakeholder engagement, and you all have, a number of you all have mentioned this already, and that is, if you have somebody that comes to you, somebody came to Lauren after it was a 16-year-old boy was shot in gun violence, and so they wanted to create a gun take back and a gun lockup initiative, and they wanted to really reduce gun violence. And so some of the folks that were involved in that, Lauren said, come to the Health Council. They hadn't been involved in the Health Council, but they were concerned about this issue, and they raised it with her. And she said, come to the Health Council and let's see if we can bring together a number of people who are really working in this area or who are concerned about this, and let's see what the Health Council can do to support you and what you can do to really move forward with this initiative. And if an initiative really, or a need emerges that really fits with what the community considers is important, and sometimes those were developed in your plan and you've got data, but sometimes things happen like COVID, or you have an emergency, or you have, you know, the gun situation that really just brought the community together. Another situation that's happened in many of our communities in southern New Mexico as well as northern New Mexico is closure of some of our nursing homes. And so lots of the health councils in a couple of areas have brought people together, got the governor to come to say, this is an issue, we need to talk about it. We need to really try to change this. And so that's part of the power of health councils. So that's what we wanted to cover with the 4 health councils. And Troy and Diana and Chris and Lauren, if you all could send to Susie any of the materials that you referred to, we can use that as the beginning of sharing materials with other health councils. And one of the things, Troy, if I could put you on the spot for a minute, one of the things that Geraldine mentioned is that you all are really putting a lot of emphasis on the importance of building relationships with the tribal leadership. And I think that's so important, whether we're talking about tribal communities or county health councils. And Troy, anything you want to share with us about that in some of the materials? And as you all are looking at this screen, I'm not able to see chat, but please put your name and your health council in the chat. I think Susie may have mentioned that when she welcomed folks. And now, before we take a break, I'd like to hear first from Susan Wilger. Susan has developed the Vaccine Equity Plan framework, and you all are doing such great work with that. She's going to say a few words about how stakeholder engagement can really help you implement the Vaccine Equity Plan, and also really support vaccine events. And then Susie is going to share about how NMAHC is providing supports to you as you really work to build stakeholder engagement. Susan.
Okay, thank you, Ann. Hi, everyone. I'm Susan Wilger, and many of you, as we know from your monthly reports, are already very much engaged in vaccine equity activities and events. So thank you. It's definitely going to take everybody all over the state because we're faced with a very challenging time ahead as numbers continue to grow. Everybody should, just a reminder that everybody should be working on your plans and have your plans submitted with your December reports. And if you attended the December 6th training, we did provide a template for your plans. And I just want to take a couple minutes to talk about stakeholder engagement because any opportunity for outreach is an opportunity for engagement and letting people know about your health council. And so as you're updating your plans, I just want to give a couple examples. And as I go through this, I invite people to please put into chat if you've had successful reaching out to some of the stakeholders in this example. We really appreciate you sharing it with your peers. So don't hesitate and please do share your ideas. So here's an example of a plan. Our target population is the most sparsely populated and isolated portions of my county, including these towns and these census designated places. It includes both adult and child populations with many Spanish speakers. So that's who I'm targeting. My outcome is that I really want to see an increase in vaccines in these particular zip codes. If you haven't heard, you'll be receiving very shortly zip code data for your counties to help you target your populations. So the data that I'm receiving right now shows that these counties that are very isolated actually have lower vaccination rates than the rest of the county and certainly lower than the rest of the state. So what my activity is I'm going to support the promotion of one of our mobile vans, which there is an event scheduled. It's coordinated by another entity in my county. And so as my health council, I'm going to help promote that these mobile vans are coming to these rural, remote areas. So my actions create flyers in Spanish and English. So who would your stakeholders or partners be there? And I'm thinking in terms of translation. Maybe you have someone on staff, but if you don't, if you could share in chat, who have you used for translation in your county? If I needed help, who should I be partnering with? Who would be one of my stakeholders? Many of you know who you've done translation. You always want to have a local person review it because sometimes either the grammar is inappropriate or the dialect. So make sure that you have a reviewer just to be sure everything is good. So the second thing, I'm in a very remote area. One place that people typically will visit are the post offices. So who would be my stakeholder or partner reaching out to the local post offices? And if any of you have any ideas, if you could share that in chat, maybe it's the postmaster, who's oftentimes a person local in the community, maybe only working part-time. Maybe the post office is connected to a gas station and someone working at the gas station. But if you can share in chat, how have you connected with post offices, especially those in the rural areas? My third example is I'm going to help distribute information about the mobile vans through churches. I know all of us talk about our faith communities. If you could share some innovative ideas that you've had in your connecting with churches or the faith community, especially in remote areas. Please share that in chat. And another example is I'm going to distribute at the food pantry distribution. How have you connected there? We know that there are a lot of volunteers. We know that there's usually a primary pantry coordinator. We know that the pantries receive their food oftentimes from, maybe there's a sponsoring organization in town who can make connections, maybe even the food bank itself. But if you have been really successful connecting with your food pantries, if you could put that in chat. And finally, we know that it was mentioned earlier by Troy that he uses his community health representatives or community health workers. Also, there are many home visitation workers who go directly into the homes. And if anybody's been successful in partnering or connecting with those folks as a distribution, if you could share that in chat.
Awesome. Thank you so much, Susan. So Susie's going to wrap us up. Susie's going to wrap us up. If you could stop screen share, Susie's going to wrap us up and then we'll go to break.
Hi, everyone. Okay, I'll be quick. Woo, I had a lot to say, but I'm going to make it fast. So what we do at the Alliance is we obviously have provided a report where you can share these successes so that they can then be shared in spaces like this. And so the part where it's asking for your successes, this is where you would talk about what you've done that has worked. So I'm just going to give a shout out to a few of the health councils. There's so many, but I don't have time to list them all. So that's good news. But for example, just be listening for things that might work for you. So Acoma Pueblo, they stepped outside their usual environment and learned new ways of working with youth groups. Hidalgo, they do specific targeting of certain sectors. Doniana, through their professional networks and their extensive email listserv, in addition to their monthly meetings, they reach out to other organizations doing similar work. And they also have numerous smaller committees that focus on certain areas. So those smaller committees can do more engagement with stakeholders. Grant County, as you all are aware, they helped launch an emergency collaborative with videos. They reached out to existing partner agencies, and this is key. They could only do this amazing work of the videos that you all have probably seen because they already had built trust with the different stakeholders. That was the county government, Town of Silver, universities, the schools, the hospitals, and a local media production company. They had already built that trust. And so that's why they were able to do that so quickly. So this work right now, you're building trust. So I'm just going to say, if you say you're going to do something, please do it, because if you don't follow through with what you're saying, you will break that trust and then it's going to interfere with your future work. Chavez partnered with local health center. Los Alamos County has a newsletter in their plans, and Catron County is thinking of creative ways to use their personal networks at their local church to do outreach there. So sorry, whew, that was fast. But yes, please, I personally like using my personal networks. It always works for me. Just read your local information. And, if you see a bank that seems to like to get involved in the community, start following them on Facebook. I mean, there's just so much. During election times, we got this one elected official that wanted to be elected, and it was a different job and it was different work, but she wanted the community to know that she was involved in the community. So we were able to get support from her. So that was my own, I was just kind of throwing in my own little spiel there. So sorry, Anne, I didn't mean to talk so fast.
Oh, so much great stuff. So as we move to our break, I want to quote Sharon. She just put something in the chat that said there's so many amazing examples of stakeholder engagement. Great work by health councils. So we're going to take a break, take a stretch, grab a, something hot to drink, whatever. And then if you have another minute or two, when you come back, if you have an example of some work that you've been doing, please add to this chat, because we're going to summarize the chat and use that as a springboard. So break time, we're going to start up again right at 2 o'clock. Thank you so much. Hey, Joan.
Hey, how are you?
I'm good. I want to thank you for trying to reach me on Friday. For some reason, my phone is not ringing all the time now. And so I didn't realize you had called me at 1, but I do look forward to talking with you tomorrow morning.
Okay, sounds good. It's fine.
Sharon, do you have a little doggy there that you can share with us? Susan, I want to thank you for that vaccine equity plan and those examples. That's just so helpful in focusing.
You're quite welcome. And I'm sure there's a lot of expertise and experience out there. So hopefully people, I did see a lot of ideas put in chat. So thanks everybody who shared.
Yeah, I am so excited. I can't wait to actually read it. So we're back, and in about 1 minute, we're going to break up into small groups, and I want to piggyback on what Susan has just shared. There's so much expertise in this network of health councils. Now is really the opportunity for you all to get into real specific examples about what's working for you, where you've got expertise, where you've got questions and challenges. And so, Madeline, I'm looking for you. And Madeline is going to lead us into our breakout rooms. We're going to spend about 23 minutes in our breakout rooms, and then come back and have some sharing about what some of your main themes were. Madeline, would you lead us?
Yes, definitely. I just posted the links to the Jam boards into the chat. So in a minute here, you'll have a little announcement that comes up on your screen and tells you which breakout room to go to. So then you can do the number associated, the Jam board associated with the breakout room number, if that makes sense. Or if you wait to go into your breakout room, the person there could tell you which Jam board to open to. But I'll open up the rooms now, and you can start joining them. Hi, Diana.
Hi, how are you?
I'm good. How are you?
Good. Is there a meeting going on?
There is, yes. People are in breakout rooms right now. We're just talking about stakeholder engagement and kind of just doing some discussion with some questions around that. So I can go ahead and pop you into a breakout room if you would like me to. It just started like a minute or two ago.
Yeah, that sounds good. Are we broken up in any specific way?
Just randomly this time.
All right, sounds good. Thank you so much. Sorry for
Yes.
my lateness.
No worries. No worries at all.
Thanks.
Yes. Let me just, sorry, I just got to figure out how to put somebody into this extra room. Oh, there we go. There you go. You should get an invite now. Hi, Sergio.
Hi, I was in another meeting, so I just came in to this one. So I guess I just need to go to my group.
Yes. Yep. We're just in breakout rooms and they didn't start too long ago. I think I can put you in a room. They're just random this time. So I'll just assign you to one of the rooms if that's okay.
Well, I'm actually in the one where Susie is the facilitator.
Oh, perfect. Okay, awesome. That's really helpful. I'll put you in that room. All right, there you go. Hi, Katie. Hello. I still see that you're connecting to audio.
Sorry.
Oh, there we go. We're just in breakout rooms right now. I don't know if you're just joining or if you had like technical difficulties or something and got kicked out.
I wish I could say it was that because then it would make it sound like I was here the whole time, but I'm actually only showing up to tell everybody I love them and everything they're doing.
Oh my gosh, that's very nice. Yeah, so we're just in breakout rooms for another 4 minutes. So if you want to hang around for a little bit, you totally can. I can also relay your message, whatever would be best.
I'll hang around. How are you doing?
I'm doing well. Yeah.
Good.
Yeah, things are busy, I feel like this time of year, especially with things kind of getting up and going, but things have been going good. I think things have been settling out a little bit too and getting a little more structured. So that's good.
That's good. There's my husband. He likes to walk it literally. The other day I was in a senior meeting with like Grace and all these governor and people, and he walked by and he just looked right at it. I said, "The camera is on." He like stared at it. Get out of here. But anyway, yeah, well, listen, the work is so important and so critical and so awesome. And it's just, I'm thrilled that I wish I could be more of a part of it. I feel like I was just starting to get involved and then they took me away from it. And like today, my boss was like, "You better quit going to equity stuff."
No, what? That's disappointing.
You know, the whole comms team quit. It was 7 people and now it's just in 2 weeks, it'll just be me.
Oh gosh, that is
Yeah.
quite stressful. Holy cow.
Yeah, Matt left and now it's just me and I care a lot more about equity than I do about any of that. So it's sad. And he said, "Quit going to that stuff." And I'm like, because he wants me to just focus on media inquiries and stuff. But I just want to say hello.
Yeah. Oh gosh, that sounds like that's a lot to be dealing with right now though. Yikes.
Well, the only thing I would say to you and the others is if there's anything that if you need help with communication stuff, always reach out to me, because whether or not, my official title is Health Equity Communications Manager, even though they're taking the equity part out for the time being, so I can focus on all the other stuff, but I'm always here for equity.
That's good to
So
know.
let me know.
And that's important. I don't know. Yeah, I feel like communication, like, yeah, you need the equity piece, I feel like, to kind of keep things. Yeah.
How is it communication in the state of New Mexico without equity?
Yeah.
It's not mutually exclusive. Not everyone sees it that way. And that's a lot of the trouble we have in the community level is the lack of trust, where's their voice? And so I want you, and please feel free to share it with anybody. I will always be an advocate. You can always call me for anything. And if you say, "We want more blank," I'll do everything I can to get it.
That's great. That's really good to hear. Yes. Yeah, lots of things moving around, I feel like, these days. It seems like this project is really just getting our feet underneath us. And then there's so many things happening. There's all the new health equity specialists and all these things happening. It seems like when the new year rolls around, things will really be sort of like moving like more like kind of steady, like everything will be rolling nicely, which I think is good.
I feel like everything's headed in the right direction for sure.
Yeah.
And that's why I don't want to just say bye,
Yeah.
We're all on the same team and we can all help each other in our endeavors. I want to go to this training about stakeholders you're having today. I want to hear this feedback. This is important for comms people to hear.
Yeah. Yeah.
Unfortunately, I missed it, but
on the fortunate side, we're supposed to have this next part. People are in breakout rooms right now talking about like stakeholder engagement strategies. And I think we're going to do a little debrief right after. So you might be joining kind of just perfect time for a little bit of conversation. There's just 5 seconds left. I'm looking at the timer. So we might have people.
Okay. I'll stand by, Rick.
Pretty quick here.
Thanks, Madeline.
Yes. Oh, but did a 30 second. Oh, yeah, there we go.
I'll mute.
I don't know. I think probably if we're struggling, most people are too. All right. See you later.
Wow. I want to thank people from room number 2. It was just amazing discussion. So I'd love to hear from a couple of the breakout rooms when you think about the discussion you've had. And thanks for capturing so much on Jamboard. We'll share that with you all within about, well, it'll be like right after the holidays. Room number 1, what were some of the main themes that came out?
I'll let Brenda share. Brenda, we were in room. I'm sorry.
I was finding my unmute. It's a little harder when you're on smaller technology. We spent a lot of time on the first question and didn't get very far on the others. But we talked about, using the traditional things, social media, flyers, whatnot for engagement. And some communities are using Nixle, which is a way to text everybody who's signed up in, like in our community, we do it through emergency management. So people are told when there's a tornado coming or something like that. But being able to use that for other things, and using marquees in town to share information was one that was pretty interesting. We talked about the need to invite people, make them know why it's important that they're on this committee, talk to them face to face. Maybe even sitting down and having a coffee with them. Chris shared about focus groups and facilitated dialogue sessions. We talked about the importance of keeping our messages positive. That keeps people more engaged because it's a positive and not a negative environment. Utilizing schools to make connections with people using their communication texts and things like that, their marquees. And one girl likes to keep up with people that she hasn't seen for a while, and she just sends them texts asking them how they're doing to try to keep them engaged. And then when she runs into people, she asked about their programs and what they're doing, and then she was able to bring it around to what she's doing and see if she can get them involved.
Brenda, that is, you all went really, really deep. And
yeah, we did.
I love it. And anything more that you can share, just, send a text or an email to Susie. Group number 2, Brenda, bless you. Alvarado, could you share some of what was discussed in our group? Or Adrian, or anybody from group number 2? I don't know if Brenda Alvarado can hear me.
Okay, there we go.
Oh, good. Okay.
Sorry, somebody was at my door here. Oh man, this was thank you for putting me in this group too. There was lots of participation, and we managed to get through all 4. But I think that what the most effective stakeholder engagement strategies that people were talking about, it just depends on where you live, and some of them were email blasts. Somebody was talking about that, and extensive listservs, definitely social media. Some were saying, involve different messengers, I think was a very common one. And involve different messengers, not just government messengers, like Department of Health messengers, involve other local partners, trusted partners. Let's see, what else can I say with that? I think some people were having some, when we're talking about facing challenges with stakeholder engagement, for some people, the social media outlets were good. For other, and not so much the printed media. And others, the printed media was better, where you have more rural and multilingual, or I'm sorry, monolingual. Let's see, populations. Let's see, what else did I miss? And
well, you covered a lot. There were one or two things that when people were talking about using local trusted messengers, and that sometimes when you have a doctor that was in a community for a long time, people really trust her. She has had Q&As, and that's really helped a lot address misinformation or resistance. Another thing people mentioned was really meeting people where they are and doing whatever you can to address concerns that people have. And a number of health councils reported that they volunteer at the events. And so somebody's coming in, they sign up to sign up, and they see a familiar face, a trusted, known person, and they go, oh, okay. And so they feel just more at ease. It was a great discussion. How about group number 5?
And I'm having problems coughing. I'm going to ask Sophia if she would lead for a group.
Okay, Sharon, I am so sorry. So group number 5, I think Sharon asked for, was it Ophelia? No. Okay, I'm going to go to another group and then come back to 5 if you want to put something in chat, Sharon. How about group number 7?
Okay. So for question 1, we were talking about our most effective stakeholder engagement strategies. And a lot of it was based on personal relationships. And so you kind of leverage the people that you already know and trust and who have helped you in the past. And you can collaborate with friends of friends. But it's mostly identifying interested people. So, and stakeholders with the shared mission and vision. But that you also have to think about appropriate methods of communication. And then the challenges that people face, mostly related to the pandemic. People can't see each other face to face. It's harder to connect on Zoom. Kind of people you work with or people you see on Zoom, you can maintain those relationships, but it's hard to make new relationships and to kind of get out there and connect with somebody you've never met with before. And you can't offer food anymore. So that takes away one incentive for getting people to gather together. And competing priorities. And then,
okay.
Yeah, and then the tools they were hoping for NMAHC, maybe training on different like best practices for stakeholder engagement or social media training, because a lot of people aren't like social media gurus. They don't know exactly what to do to get the best response. I mean, people can post something, but they're not quite sure. And they want it to not be toxic like some social media is. They want to make sure they keep it positive because they see things about how social media is bad, but they don't want this to be a negative thing. Again, it should be positive.
Okay, very, very helpful. How about group number 4?
I facilitated that group and I was remiss in asking for a spokesperson. Is there anybody from group 4 who would like to report out? Okay, I'll go ahead and do that. Much of what people already said was stated in our group with questions. One thing that was really effective back in the day, or if people are still meeting in person, was to offer food as an incentive. But having face-to-face meetings, like even one-on-one meetings, to engage people and develop those relationships. Also having follow-up meetings. So if they couldn't make the health council, or you're wanting to keep them informed, or they're interested in being informed on what's going on, doing various follow-up meetings, both to inform them, but also to as continued engagement with some of the members, and making sure that, you know, that you're targeting their interests as a way of engagement. On the second questions, you know, one of the major, two of the major challenges are time, and then having where you typically have the same group of people who are taking on the leadership and responsibilities. And so those are really critical challenges. The other thing is with COVID, there is so much focus on COVID. There's some sense of COVID burnout, and stakeholders want to focus on other issues or move beyond COVID, which is really difficult to do during these times. And in terms of the third question, which is as far as we got, with priorities for building stakeholder engagement around diversity, equity, and inclusion and tools, you know, obviously trust building is one of those key things. The other great idea was merging events, so that, like, rather than just having a health fair, maybe you're doing something at a community event, so that you're able to get access to more diverse folks, and they learn about the health councils. Is there anything else I missed from group 4?
It was awesome, awesome. So Sharon, our group suggested Zoom training in how to use the translation function. Maureen and I agree. So Sharon, could you or somebody else speak for group number 5?
So Sharon, did you want me to, or you?
Sharon's going, yes, she really wants you to.
Well, I don't think I can do it any justice, honestly. I still I feel very much like a fish out of water. But the question was what again?
Just what were some of the main themes that came out of your discussion?
So, you know, the getting stakeholders involved. One of the things that I spoke about was really utilizing our connections with county, municipality, and other organizations that are many that have the same focus that we have. So like with, you know, the hospital and addressing the opioid and, you know, need for COVID vaccines, those types of things, working together with key stakeholders that really are vested in what is going on as far as our community needs. Then, you know, there was the talk about the social, well, I'm reading Sharon's notes also, but the social media training. And I noticed in the feed that someone talked about TikTok. I'm the same with that. You know, there's some things that we're totally not able to utilize because we just don't know. So training is one of those things that's important. You know, one of the other things was getting people involved. And as it's been said in most of the groups, it is difficult, especially when you're in a small community like ours, where it's the same people volunteering for the same groups. And one of the things that I didn't talk about, but in hearing this, is that we also need to be careful that, because we have the same people in the same groups often, that we don't have that burnout that they're experiencing, and it can very easily become cookie cutter in the ideas, and we don't grow it. You know, we kind of stay stagnant in the same mindset. So it's really important to try to involve and include diverse our diverse populations, and welcome all people, and just let them know that, I'm really about meeting people where they're at. And sometimes, it might be a little intimidating if you're, not a high school graduate, or you're in high school, but you have great ideas and you feel uncomfortable speaking with like the director of nursing, or, that type of trying to create that fusion where we can get new ideas and new energy into serving our community as best we can with the health issues that are present.
Sophia, that's terrific. And one of my big takeaways from what you shared is realizing, particularly when we're looking at small communities, we have got a lot of the same people going to 5 or 6 different meetings in the week, and you go, oh, okay, I saw you over breakfast, or I saw you at lunch. So Victoria, I'm wondering if you could report on your group, and I also see you have a hand raised.
Right, I just wanted to make sure Marina's gonna report for our group. I just wanted to make sure she had a chance.
Yes, so because I will forget, some of the answers was really what other people have mentioned. So I'm gonna try to highlight the ones that may not have been mentioned, such as in our health council meetings or community meetings, to have a specific topic, not just meeting just for the sake of having a meeting, but to actually have a topic and then some call to action, because people like something to do, but if we don't give them something to do, they may not have that opportunity. Respect people's time, energy, and limits. The various outreach strategies in different channels, traditional and digital. This is more of, like marketing, traditional channels, digital channels. Having clear objectives, having the meeting at a space where most people feel comfortable and that it's centered to the community. And also the times, I forgot that, right? Like if we want to have a community meeting, but we want to have it at 1 p.m., well, we're not going to be able to reach out to the community because guess what? That time, most of us are working, right? Let's see if I can move to the next question. Some of the challenges that we're facing as everyone else, COVID-19 pandemic, the consultation fatigue, community feeling burnt out, language barriers, cultural differences, lack of funding, lack of staff to follow through these programs or projects, and lack of time because we want to do everything and anything. So we don't have all the time that we want to have to actually see, the project from start to finish in the way that we would like to see it. So really prioritizing what needs to be done for the Health Council. Our community, some of the challenges also that we're facing for our community engagement is the lack of internet access. And also, even if, the community that we're trying to reach may have internet, but may not know the technology or may not be savvy enough to do a Zoom call instead of an in-person meeting. And we just got to question number 3. Some of the priorities for community engagement is, providing diversity, equity, and inclusion. It's having actually do the pre-work of listening well to our health equity team and not rush to check boxes. One of our compañeras said the data has been great, but the crunchy timeline, not so much. Having people in health councils who look like people in the community is important, and also that speak their language. Build the trust so that all voices continue to participate. We don't want to lose any more of our partners. We lost 3 on last Friday just due to staff movement at the year and change of jobs. And then the last one I want to share is ongoing two-way process of building relationships, working collaboratively to support all. And some of the trainings that we would like to see is just training in what equity is. And something I forgot to add, but I'm thinking about it right now, is community organizing. We may not, all of us, have the formal training or the life training of community organizing. So I think that would be great. And also, we used to do this a lot with electoral campaigns, which we may not have the same funding, but canvassing, the face-to-face door knocking, in my experience, has been the most effective way of reaching out people, and actually not just reaching out like to mark our numbers, but actually being able to have a conversation with the community. Am I missing anything, Victoria? Probably.
Woo, Marina,
Thank you, Marina.
that is such a powerful presentation. And do I understand correctly, you're the health equity person for Rio Arriba County, is that correct?
That's correct.
And you already have a committee up and running. I just loved your presentation. And Rio Arriba is on the cover of Rolling Stone magazine. So, hey, thank you. I know. What is it? On the cover of the Rolling Stone. So,
I know, we'll share the video to the song soon,
yeah,
with
absolutely.
all of you.
Geraldine, would you take us home and give us a summary of what you all talked about? And then we'll wrap up. I have just a very few things to share and wrap up.
Hi, yes. Okay, so question one, with the most effective stakeholder engagement strategies, Grant County shared that for them, it has definitely been forming a task force. And through this task force, they've been provided a variety of entities, resources, contacts, and agencies. So forming networks has definitely been very helpful. And then we've had some who mentioned that they're reaching out to and participating with other groups who they have found that they have shared priorities with the Health Council. So again, it's just networking and finding those aligned priorities, goals. And then also we did mention that one of our health councils is building on their organizing skills, using that as an engagement strategy to work one-on-one with their stakeholders, and always asking the question, who else should we reach out to? And that brings me to my next idea, the next strategy that was mentioning of community input. So some of our health councils definitely agreed that they are reaching out to community and trying to make sure that they emphasize that the work that's happening is beyond health council and organizations and agencies, that it's really around community and trying to get community voice at the table. And then also another thing that was mentioned was social media has been really helpful, but it's not the only way to engage with community and partners. So realizing that there's, this traditional versus modern stakeholder engagement, and then some challenges that we discussed, definitely Zoom fatigue, people checking out, and hybrid meetings, challenges with people multitasking and in-person conversations, that not resonating with those who are online. So that's very difficult to kind of find a balance between that. Some mentioned general fatigue. We're nearing the end of the year, so definitely can see that. Internet access and connectivity for some of our rural and tribal communities. Health councils are finding that they're not connecting with as much as of the rural communities as they used to, as opposed to in-person meetings that they normally would have. And then messaging. So I think a lot of the messaging maybe kind of being like maybe more depressing and not as motivated and enlightening, especially when it comes around the subject of COVID. So trying to change the messaging to engage with more community and get more messages out. And I think for the most part, that is mostly what we discussed. And we were just barely touching on the subject of question 3.
So much rich discussion. So much rich discussion. I would love it if you all would keep adding things to the chat. Madeline, we're going to have copies of the Jamboards. Is that right? That's great. If you could share that with me. We want to try to capture what has been shared here today, send it out to you all, and then have you add to it, because the expertise that is in this room is amazing. It is really humbling, because as I think about what we've talked about today, I go back to some of my slides, and you all have really covered so much of this rich network in terms of stakeholder engagement. You have really outlined so many rich tools and strategies, and I knew you would. And if we're able to build this collaboratively and collectively, we will have so many great tools and strategies, as well as a really helpful articulation of what the challenges are. Because I love what Geraldine said about just the COVID fatigue and the real need to change the messaging and to work together in community. And so as we build our strategies and talk, really in a transparent way about what our challenges are, we're able to help one another then move forward. And as I look at this that I shared earlier, there's so many mixed methods that you all are involved in using, and highly engaged interactive. I love what I think all the groups talked about: relationship building and building trust and listening. I think that might have been Gerald in your group, the power of listening, or that might have been Marina, but just all of these pieces are so rich. And so I want us to wrap it up with a very short, a couple of thoughts that I have. And it's pretty much a holiday theme. We've lived through hell in the last couple of years. We've watched people, most of us have had people that we've known and loved who've been sick or passed away. We've seen the economic impacts of COVID. We've also seen the power that happens when we work together. And if I think of anything in terms of our work together, the health councils, and it was reiterated in all of our small group discussions today, you all do so much powerful work. Health councils are building community health. Our health councils, and when I say health councils, I mean with all the partnerships that includes DOH and community schools and our faith communities and so many groups, but by pulling the community together and creating space for a community voice, you provide, together, we provide the opportunities to transform many of those challenges into community building and into joy. One of my favorites is called The Book of Joy, and it's by the Archbishop Desmond Tutu, and Archbishop Desmond Tutu and His Holiness the Dalai Lama. And those two men have really walked through hell and back and have lived through huge challenges. And they talk about joy, because joy is what we bring when we have lived through hard times and we have worked together to overcome things. And I am so moved by what health councils are doing together. As Susie said, health councils we're just rocking it. And so I want to thank you all for everything that you are doing and for just who you are and who you are able to bring together to make a difference. And I think that as we're looking at these vaccine equity events, Roberto at DOH is going to be sharing information, and Sharon and Susie are going to be sharing information about both the mobile vans and the FEMA buses. I just want to thank you all for everything that you're doing. And Susie and Sharon, do you want to take us out?
I'm sorry, guys. I'm having a little bit of an internet issue, so I turned my camera off. But I just wanted to make one. Thank you so much for that, Anne. Thank you. I think this was a really great session. We have 5 more minutes, but I just wanted to make a comment. to just do a little tiny pivot is we've been having some questions about the reporting. We're all learning. We're only going to start we only have done 2 reporting periods. Some health councils are just now getting, you know, kind of their feet wet with that, and they're having some questions. There have been a lot of adjustments to the reporting. So Geraldine and I are willing to stay over after this training to give like sort of like an open office hours. We don't have anything formal planned, but we just wanted to make that available to you all. So if you have any questions about the, you know, anything at all, we're here to help you. So I just wanted to bring that up, Anne. And if there's nothing else, then thank you all for joining. Does anyone have anything else to add? Nope. Okay. I'm just going to be hanging out here. So whoever needs to help with their reporting, stay behind. Geraldine and I were here to help you. Thank you.
Thank you.
Susie, thank you so much.
Thank you. Happy holidays, everybody.
Happy holidays.
Happy holidays.
Happy holidays, everyone.
Hey, Geraldine, this is Adrian.
Thank you. Happy holidays, everyone.
Hey, Adrian.
Just a quick update on the land grant. I did talk to him finally and sat down with my cousin, and he's going to reach out to this other committee that takes care of all the land grants in the mountain areas. They have like a little subcommittee that they do. So I'm waiting to hear back from their chair. And then once I hear back from them, then we'll set up some sort of meeting.
Great. Well, I'm so happy to see it moving forward. And yeah, I will definitely give Sharon the update, and we're excited to hear from them.
Okay, thank you. You guys have a great day.
Thanks, Adrian. Happy holidays.
Now, this is Joanne, Travis County. I have a quick question. When we submit the plan, is it like every event we're thinking about for the next 6 months and then update it as we go, or just for the month?
I'm so sorry. Can you repeat that?
To submit the plan, is that going to be like just the December events, or would it be the events that I'm working on for the future 6 months also? Just kind of put out. I'm sorry, go ahead.
No, that's a good question. So Susan, correct me if I'm wrong, but this is things that you're planning to do in the next few months in the future.
Okay, very good. That's what I need. Thank you.
No problem. Thank you for the question.
My question, hi. My question is, if we're closing on the 23rd, I believe, for the rest of the year, do we report this week, or we wait until the 5th, or a few days before the 5th?
Another good question that you're not the first one to ask. So I'm sorry, I'm just taking over all the answers. Please, anybody chime in, Susan or Geraldine. So yeah, we have quite a few people that are taking the vacation. Here's the thing. So many of the activities and successes can happen even if you don't have a big event planned. So we're really strongly recommended that you don't do the reporting until the last day of the month. You know, especially, so we had one health council that she had the same issue, and she's like trying to get ahead. So she clicked onto an old invoice link that she was using from the last time. Well, it gets adjusted because, you know, we make adjustments. And so it was a little confusing. And so, yeah, so we're recommending that you wait. Just remember that they're due on the 5th. And then if anything is wrong with what you turn in, you have until the 10th to fix it. Did that address your question? Okay. Now, we have had situations where someone is out for like the 4th through the 11th, and bad timing. So what I'm going to recommend is to cross-train, have someone else in your health council that can pick it up. If you're the only one that knows how to report, then make sure there's someone else that can do that for you. And then of course, the other option would be that you can report whenever you are next available, but the invoicing, if you miss that because you're out, you can do double invoicing the following time. You would just not be able to get your money until that time. Thank you.
Thank you.
Let's see, do I have any questions in the chat here?
Oh, I don't see any questions.
was missing in action for a few minutes because I had to go meet with the governor. Did I miss something? Miss anything?
Oh, go ahead, Geraldine, you tell.
Oh, I think, are you talking about during the Zoom? I think Anne was asking if, a little bit about tribal leadership and kind of the importance and, what that looked like. But it's okay. We can always, maybe you can include it in your little follow-up that we're going to be sending out to health councils.
Yeah, we are. I'm, as you can see, always there with tribal leadership because that's just part of it. I didn't know if I missed anything because I stepped out.
No, you're good. You're good, Troy.
All right. Well, see you all later and have.
Okay. Oh, and I also received your roster and I'll be forwarding that to Susie. So thank you, Troy.
I got that.
Okay.
Thank you. Yes, thanks, Troy. Okay, let's see, who else is there? Anybody else?
No,
This is Ron, and I just had clarification from Geraldine about the capacity assessment. Monica is worried about that, but I'll let her know because she's actually, we talked to Geraldine last week. We had a meeting, so Monica's been in and out of the office, in and out due to having to use her leave or lose. So she just worried about the capacity assessment form, the template.
Okay, and are you clear about this? Did you get your answer on that? Because that's a good question.
Yeah, she said just to put Jordan's, just, what did she say? I'm like,
Rhonda, so because we haven't had any training on that yet, you can go ahead and just answer, if I'm wrong, Susie, no, right? Because we haven't done capacity assessment training. And then there will be a capacity assessment survey that we'll be sending out. And that training is supposed to happen on January 3rd. So that was my fault. I gave you the wrong date, but it'll be coming up. So don't stress about it too much right now, because we'll be getting to that soon.
okay, no, I understand. It's okay. It's just that Monica she likes to get stuff done. And I do too as well, just make sure everything's done right in the right way to continue to with the grants, and as the grants money come in, as you do the paperwork as needed.
No worries.
Okay, I'm half asleep. Sorry, I was up early. We had a death this morning, so we were up this morning early. But I kind of felt bad because I was kind of late. You know how it goes on tribal land, so I'm a little tired. Sorry.
Oh, good. You'll get some rest, Rhonda, and I'm sorry for your loss.
Yeah. Okay, thank you guys. Have happy holidays.
You
Thank
too.
you.
Okay. Okay, bye.
Is it?
Yeah, I think Samantha's otter, because she was in my group and there was no response. So I don't know if she signed off and forgot to disconnect with the otter connection.
Oh, I gotcha. And Althea? Who's that? I don't think I know.
Althea, are you there? Apparently she's signed off as well.
Okay.